Hello, good evening, and welcome to the Functional Solution Podcast brought to you by the American Academy of Functional Health. My name is Tal, and I'm joined by one wonderful co-host, Dr. Esha.
Hello.
And as usual, we are really thrilled about being here with you today because this class today is really dedicated to um, uncovering the root causes of chronic diseases and gaining practical tools to help your patients thrive. So if you're looking for learning more about functional and integrative medicine for chronic conditions, you're in the right place at the right time. So every week we explore actionable science-based strategies to develop and develop your functional medicine skills in your clinic and beyond. And in today's episode, we're going to dive into the really fascinating connection between the gut microbiome and thyroid conditions, more specifically hypothyroidism. Now, we're coming to you live, so if you have any questions during our class, feel free to put it in the chat so we can answer any questions while we have Dr. Esha here. And Dr. Esha has years of clinical experience in integrative and functional medicine, so I asked her to join this podcast, and so we can discuss these different conditions. She can share from her clinical experience, and we can kind of put our minds together and help you with your advancing your clinical skills. So Dr. Esha, I'm really excited about today's topic.
Yeah, I'm excited about it too. I feel like it's something that you don't hear discussed too. Well, I would say you hear discussed often, but I love the way that we're going to talk about it today. So I'm excited as well.
Yes, absolutely. And we have some really fascinating, I would say, clinical studies that we want to share with you. Some really interesting pictures that will kind of really make it clear on how changes in your patient's gut microbiome can impact the function of the thyroid and also the levels of thyroid hormones, right? And I know that Dr. Esha, the gut health is a topic that you find very interesting.
Yeah, it influences every organ system in the body. When you look at it, there's like new conversation every day in the science community about new gut axes. Where else is the gut impact in the body that we previously did not understand, or just more information about those pathways. So, yeah, I'm excited.
Yes, absolutely. And as you said, we're really discovering more and more, probably in the last 20 years, on how the bacteria, the ecosystem in our gut is really doing a lot more or much more involved in our physiology and healthy function and the disease pathophysiology than we thought previously.
Correct.
Right?
Yeah.
So this is going to be really interesting to look at how these imbalances could trigger imbalanced thyroid hormones, right? And this is a really important class because there's so many patients out there that are struggling with hypothyroidism, right? I think from what we've looked at, the data, the American Thyroid Association reported that they estimate that about 1 out of 8 women during their lifetime is going to have essentially going to be impacted by a thyroid condition, and it could impact both sexes and all age groups. But it's especially prevalent in women, and it's very often, unfortunately, underdiagnosed, right? And one thing to mention, this is another reason, like, why would we pick hypothyroidism, right? There's so many conditions out there, but there are unfortunately so many patients out there who, even after diagnosis, continue to struggle with the symptoms of hypothyroidism, right? So that would be fatigue, weight gain, depression, cold intolerance, hair loss, brittle nails, right? And this is something that is really important. Even when their labs, they might get levothyroxine or some sort of synthetic T4 or even a compounded hormone replacement therapy, but they're still struggling. And I'm sure, Dr. Esha, you've seen that in some.
Oh, yeah. Yeah, there are plenty of patients who have been on thyroid medication and treatment for decades, right? And they just kind of go in and monitor their labs, but they still have all these symptoms. And so that's a huge area in functional medicine, integrative medicine, kind of optimizing the endocrine system outside of just kind of standard protocols.
Yes, absolutely. And when a patient comes to see you, and they report that they still have those symptoms, right? Maybe persistent weight gain or fatigue or depression, we always try to look at the whole picture, right? This is something that I've learned over 20 years in healthcare is really how can we help them to transform their health in the long term rather than just try to provide a short-term solution such as a hormone replacement therapy, right? Which is beneficial, and it's when it's needed and indicated, it's important. It's an important tool to have,
right?
But we have to ask ourselves the question: what's causing those symptoms? What's the underlying cause? That is, why do they have low T4 or T3? Right? If the thyroid is supposed to produce T4, and that T4 is the active hormone that is then converted to T3, what's happening? Why do they have lower amounts, right? If we substitute those by giving them medication, then their labs might look better, their body might start utilizing some of these hormones, but have we really addressed what's causing the underlying deficiency of those hormones, right? There's something that is going on there that we have to address. So this is why it's so important to understand this topic, and I'm so glad that we're diving into one of the, I would say probably one of the major root causes for thyroid hormone imbalance and hypothyroidism, which is the gut microbiome shifts. And we know that there's multiple reasons for why patients could have a imbalanced gut microbiome. We'll use the term dysbiosis today in our discussion, but it could be antibiotic use even years ago. It could be dietary pattern. It could be environmental factors. It could be stress, right? It could be an autoimmune condition, right? It could be multiple situations, right? So that would be really important. And today we're actually going to dive deeper into what's happening there. How is that connected? How can that shift? How can gut microbiome shift? And certain bacteria can actually cause patients to have either subclinical hypothyroidism or hyperthyroidism. So this would be an interesting one to go into.
Yeah, excited. Let's get into it.
All right. So, Dr. Esha, maybe take us first into a short overview of the thyroid function, thyroid hormones, such as kind of as an overall intro to this topic, and then we'll dive in further into the gut.
Okay, totally. So what is the thyroid? So we're going to put an image up to show you where the thyroid gland is. You'll see in this image, it's from informedhealth.org. The thyroid is seen, and it's often described this way, as a butterfly-shaped gland in the neck, and it can weigh between 20 and 60 grams. And for reference, like one AAA battery weighs about 20 grams. So 1 to 3 AAA batteries in weight is how much the thyroid gland typically weighs. The role of the thyroid gland is to produce hormones, namely your T3 and T4. It also produces calcitonin, which is one that regulates calcium levels in the blood. But T3 and T4 are the more kind of hormones we focus on in terms of thyroid metabolism. So these hormones are important for regulating physiological and developmental processes, including metabolism, body temperature, musculoskeletal system, brain health, cardiovascular function. And there are receptors for thyroid hormone distributed across the entire body, across most of our organ systems. And so that just shows the importance of thyroid hormone in the entire body, not just in metabolism or body temperature, but even when you think about gut health as well, we see influences there. So that's one picture. We're going to show another image. It's an illustration from the journal Frontiers in Endocrinology. And this is just showing an overview of the principal target tissues for thyroid hormone. So principal target tissues, but not the only tissues that thyroid hormone targets. So as you see, the thyroid hormones impact many different organ systems and tissue types where they're able to bind to receptors and exert these physiological impacts. So just for example, you see the heart there. So in the heart, thyroid hormone can increase heart rate, increase your cardiac contractility, improve systolic function of the heart, improve diastolic function of the heart. It can also decrease systemic vascular resistance. Those are some really important jobs just in the heart alone. And that's just one organ system. And then in other tissues, thyroid hormones have completely different actions. And so when it comes to your the thyroid hormones, T3 is considered the biologically active thyroid hormone, whereas T4 is considered a pro-hormone that can be converted to T3 in distal tissues like the liver, your skeletal muscles, kidneys. So 80% of the hormone coming from the thyroid is actually T4 and 20% is T3. And then 80% of T3 is produced outside of the thyroid through a process called T4 I can never say this word, T4 deiodination. And so that's kind of a general primer on thyroid tissue, primary target sites, and then just the hormones in general, which one is more active, and then how they convert. So I'm going to pass it back to you, Doc, for the next phase.
Thanks so much for the overview and really what we wanted to show in this like really short intro on thyroid, because most of our community members are healthcare practitioners, and as part of the advanced functional and clinical functional medicine program, you have to be a healthcare practitioner. But it's really just as a reminder that the thyroid hormones impact so many parts of our body, right? From our metabolism to brain function to musculoskeletal system, right? It just impacts so much. And of course, you know, when we talk about doing we have a specific program for metabolics and weight gain or weight loss called the functional weight loss consultant, where we really dive deeper into how the thyroid, the environmental factors, the gut health all impact weight gain, right? But it's just really a reminder of how the thyroid is so important. And I'm sure you've seen over the years patients that come in and they might have subclinical hypothyroidism, right? And that's something that could impact. They could have some of these symptoms, but they have not yet gotten a diagnosis.
Exactly. Yep.
Right. So let's go. So now that we covered that, let's go into the gut microbiome and talk about really what shifts in the gut microbiome. How does the gut microbiome really connected to the thyroid, right? The thyroid hormones. So we know that the gut microbiome is really a complex system, right? We have trillions of microorganisms, right, in our gut and in our body, right, on our skin, in our mouth, for female in the vaginal area, right, in the vaginal and genital area. So it's a big topic, right? And we have a symbiotic relationship with those bacteria, right? Now, we're going to talk a little bit today about diversity. We're going to talk a little bit about the amounts of bacteria. Both are really important, right? So if you remember two things in regards to our microbiome, we want to remember that there's two factors that impact the ability of those organisms, right, microorganisms, to impact our body's function. One is the amount of bacteria. The second thing is the diversity of bacteria, right? And so the diversity is really important. It has functional capacity, systematic influence, and it's often when you read some studies on the microbiome, it's often described as a virtual organ with its own separate function, right? And a well diversified gut microbiome is really associated with many protective effects. It contributes to the healthy metabolism and prevention of obesity, metabolic syndrome, and even type 2 diabetes. In contrast, if you have reduction of microbial diversity, let's say you've lost certain species of bacteria, which is well documented, it is associated with an increased risk of metabolic dysfunction, insulin resistance, even systemic inflammation. So let's take a look at an interesting image from the journal Frontiers in Microbiology. And it really highlights several health promoting outcomes that are associated with balanced gut microbiome. So you can see in the center of the picture, we have the gut microbiome, right? You can see the different bacteria and then the connection and the different systems that could be impacted by this gut microbiome. And so you can see on the top, we have the gut-brain axis, which we know now, for example, if we talk about the gut-brain axis, we know that the bacteria in our gut, that ecosystem, can stimulate brain and impact brain function, brain chemistry, directly through the vagus nerve and indirectly through bacterial metabolites. So you have some of these factors on the left side, and it's a little small, so I'm going to describe some of them. So for example, the bacteria in our gut can produce certain short chain fatty acids, such as butyrate, which has an immunomodulating impact, which in other words, they regulate our immune system to reduce the inflammatory response, right? They also prevent pathogenic colonization of bacteria that are harmful, right? They maintain and improve our gut barrier. They reduce inflammation in the gut. They support healthy digestion, production of vitamins that are essential. And we got to talk about some of these nutrients. They also produce additional beneficial metabolites, and they support a healthier body weight, right? So essentially, by producing some of these metabolites, fermenting fiber and producing some of those metabolites, they can release short-chain fatty acids, and some of those short-chain fatty acids go into our bloodstream, all the way to our brain, crossing through the blood-brain barrier, and are utilized by our different body systems, right? So that's one axis that we, of course, dive much more in depth in the program. But on the upper left side, you can see the gut-brain endocrine axis, which is more of our focus for today's conversation. But what I want you to remember is that there's other axes, right? There's the gut-heart axis, the gut-bone axis, there's the gut reproductive axis. There's actually, just as an example, and it's really fascinating, there was a particular study that found that changes in the gut microbiome are associated with changes to the vaginal area. And there's another study that found that changes in the gut microbiome are associated with a shift in the bacteria on the skin. So just think about how would that impact a patient that has eczema or other skin conditions, or had reproductive access, right? Maybe have repeated UTIs, for example, right? So we want to think about that this concept in more of a like a big picture type of an approach, right? And then, of course, we have to remember that if the gut microbiome has now shifted to become imbalanced, right? Or what we refer to as dysbiosis, dysbiotic, right? Dysbiotic could be there's that your patient have lost some of the beneficial bacteria because of diet, because they chose to have a certain diet, or they are on certain medication, right? Or they have a certain lifestyle, right? Or they now have more of the unhealthy bacteria in their gut, right? This is what we refer to as dysbiosis. And that's a very general wide term to use, right? In dysbiosis, there's SIBO, there's different dysbiosis could mean different things, but it could interfere essentially with how our body produces, converts, and uses thyroid hormones, right? So for example, a healthy gut helps to convert the inactive thyroid hormone T4 into the active form, which is T3. Now, the gut also supports the nutrient absorption. So when we're eating food that contains selenium, zinc, and iodine, which are essential for thyroid function, right? Our gut microbiome helps us to supports the absorption, right? And if you're not absorbing enough selenium, if you don't get enough selenium, then essentially that is associated with increased risk of developing higher antibodies, right? Antibodies against thyroid. If you're not taking enough, zinc is also important for immune modulation. Iodine is important for thyroid production of the thyroid hormones, right? And it also, having a healthy microbiome also helps you to regulate the immune system and reduce the risk of conditions such as Hashimoto, right? Autoimmune conditions. So again, all going back to treating the root cause. Now, if your patient has dysbiosis, they came to see you for addressing their symptoms of thyroid. If you just prescribe them hormones and you do not look at the gut and you don't look at the other factors that are involved in that, essentially what will happen, maybe their labs over time will become normalized, but what happens to that underlying inflammation, right, that triggers autoimmunity, such as Hashimoto thyroiditis, right? And they're still not getting the right short chain fatty acid production. They're still not getting the right nutrients that are important for thyroid function, right? And this is why so many patients continue to struggle, right? So by impacting the brain, the immune function, and regulating the inflammatory response, supporting nutrient availability and the gut microbiome and the brain through the gut-brain axis, the gut microbiome can impact the endocrine system, which includes the thyroid. So let's take a look at another image from the same journal, which illustrates the distribution of specific gut microbial strains along the gastrointestinal tract, as well as the potential negative health outcomes. This is again from Frontier in Microbiology, and this was published in 2022. We put the citation on the right side, so you can feel free to read more, dive a little bit deeper. But you can see, for example, on the left side, how the different strains of bacteria in our stomach, duodenum, all the way to our colon can really impact our the different functions on the right. So we know that the gut has the stomach has the lowest microbial concentration, while the colon has the highest amount of those microbes. And the two dominant bacteria are Firmicutes and bacteroides. And as previously discussed, they really interact with most major organ systems. So you can see, for example, on the top, how these bacteria are associated with the disruption to the gut-brain axis, leaving patients with anxiety, depression, IBS, associated with even cognitive decline. When we talk about the gut-brain gut-brain endocrine axis, we're talking about dysregulation, we're talking about metabolic impact, we're talking about behavioral and hormone disorder. And then we have a specific class designated to gut-heart axis, showing you how what the studies are showing on how the changes in the gut, very specific, can impact cardiovascular function. So when you look at this is sort of an overview and a big picture on how the gut microbiome, and we know now the specific gut bacteria and how they impact systemically and on some organs, more specifically on some organs, because that association is already established in so many studies that we reviewed in the last 10 years. And so when we teach those topics, we show you what would it look like in the lab testing, what would it look like in terms of the treatment protocols. And there are functional lab testing, there are tests that are very specific for evaluating the gut microbiome. So one of them is, for example, the GI 360, which is a very comprehensive testing. It's a stool analysis, simple stool analysis. The lab kit is shipped to the patient's home. They provide a stool sample, send it back to the lab, and the lab provides you, the practitioner, with a snapshot with a detailed analysis of what's the balanced bacteria, that's the healthy and unhealthy bacteria, what bacteria are associated with inflammation, and of course the detailed breakdown of the short chain fatty acids, the important metabolites that those bacteria produce. What does the inflammatory markers look like, right? There's a lot more to it, but we teach you literally step-by-step understanding the mechanism, so you understand when you look at those labs, you have a comprehensive understanding of what's going on, what is the next step to help those patients to really treat those conditions from the inside out, right? And so it's a fascinating topic, and of course, we need more than the time we have today to dive into it. But I wanted to share this with you because this is a really, really, really cool picture to have a better understanding of these connections. And then there is also if you have Netflix, there's a really cool show. It's called Hack Your Health: The Secrets of Your Gut, which explores the connection between gut microbiome and various different aspects of health and disease. And they actually take different individuals. So one individual has been struggling with weight gain, trying different things, and she's still struggling. Another person have lost their sense of taste. Another person, so they take different individuals with different conditions, right? And they test a stool sample. They send a stool sample to the lab, and they essentially have a one-on-one consultation to help those patients understand how their gut microbiome, specific bacteria, are connected to or contributing to those conditions, which is fascinating. It's a lot of fun to watch it. So, and they got some really cool visuals to show the gut microbiome. So I highly recommend to watch that. It's on Netflix. So Dr. Esha, I know it's a big topic, but now that we understand the different connections between the gut microbiome and how what happens in the gut microbiome doesn't really stay in the gut microbiome.
Exactly. I like that. Yeah, so I love that you broke down the kind of good bacteria we typically see, and then also the dysbiotic picture, and how you just kind of show that overview, how the gut impacts and interacts with all these different systems in the body, including the endocrine thyroid system. So yes, so much to talk about. Okay, so we're going to talk now about dysbiosis specifically and its impact on thyroid function and nutrient absorption. So if you look at some of the emerging research, we see this highlighted connection between gut health and autoimmune thyroid diseases, which is pretty much like Hashimoto's, which is hypothyroid, and or Graves', which is more of a hyperthyroid condition. So a balanced intestinal microbiome plays a critical role in supporting proper thyroid function, particularly through its influence on the absorption of these key trace elements like iodine, selenium. So your gut is about 20 feet small intestine, and I think it ranges from like 10 to 20, depending on person, but average like 20 feet of small intestine, and you have like 5 to 6 feet of colon. So that's a lot of space for absorption, and kind of there's also a lot of space for things to go wrong. So when you think about this picture of absorption, the gut is huge for supporting all of our body systems, especially our thyroid endocrine function. So disruption of the gut ecosystem, whether that's through dysbiosis, which can be caused by a myriad of different things, or actual damage to the intestinal lining. Think about certain medications like NSAIDs that can directly damage the intestinal lining. This disruption of the ecosystem can impair the function of surface enzymes and transporters, ultimately reducing the body's ability to absorb and utilize these nutrients effectively. So selenium in particular serves a dual role. It's not only vital for thyroid hormone metabolism, but it's also essential for regulating inflammation and maintaining the integrity of the gut barrier. So a deficiency in selenium may contribute to a breakdown in the microbial balance and increase the risk of immune system dysregulation. And then there's some really cool literature around specific pathogens that can influence or that may influence thyroid autoimmunity. There's some interesting literature around H. pylori, which is in the US, like a pathogenic stomach bacteria. But in other cultures, it's interesting, you'll see it kind of as a commensal, just normal, if you will, bacteria of the stomach, and it doesn't really cause issues across some cultures. And then in other cultures, depending on the strain, you'll see actual pathogenic disease. So there's some correlative there between H. pylori and the possibility of it kind of elevating thyroid autoantibodies, so potentially serving as a trigger for thyroid autoimmune diseases. And then there's some research that does not support that theory, but it's really interesting to think about microbes and how much they can influence in our body. So let's take a look at this image from a 2024 publication in the International Journal of General Medicine. And it's looking at the relationship between dysbiosis and thyroid function and dysbiosis. So we see these unfavorable changes in the gut microbiota, which is dysbiosis, can lead to thyroid dysfunction, and then vice versa. So you see your gut microbiome here. So you see malabsorption of nutrients, which we kind of talked about, that selenium iodine piece that can impact your thyroid. You see activation of this T helper 17 cell, which is pretty much a pro-inflammatory cell signaling system in the body that can be upregulated due to gut microbiome dysbiosis. That can trigger issues with the thyroid. Malabsorption of those nutrients can trigger issues with the thyroid. And then also with dysbiosis and microbiome issues, you have a reduction in that butyrate component, which is also anti-inflammatory in the system and can impact the thyroid picture. Then the other side of that, you see thyroid dysfunction, thyroid hormone deficiency can impact your gut microbiome. You see a reduction in bacterial diversity in the gut microbiome as a result of thyroid dysfunction. So it's kind of a bi-directional pathway, which is why they call it the gut thyroid or gut endocrine axis, because they both impact each other. And then if you look kind of in the center, you'll see how thyroid dysfunction, you see the arrows are pointing both ways at all times. So thyroid dysfunction can impact your immune system, which can potentiate and impact the gut permeability. So you have that leaky gut, which is back to the gut dysbiosis picture. Then the other way around, you have gut dysbiosis, maybe not related to thyroid issues or thyroid dysfunction. That can in and of itself create a leaky gut situation that can impact the immune system and then impact thyroid function. So they're both really bi-directional. The gut microbiome has specific ways it impacts the thyroid, and then the thyroid has specific ways it can impact the gut microbiome. So like what Dr. Tall was saying, when you have a patient that has any kind of autoimmune disorder, especially like a thyroid picture, you have to pay attention to their gut. You should always be looking at ways to support their gut microbiome, either through testing, diet, supplements, many ways you can do that are simple. Then there are ways you can do that are more complex, but it definitely needs to be a piece of the puzzle. So let's do a pop quiz. So which of the following statements is true regarding the connection between gut health and autoimmune thyroid diseases? A, selenium plays no role in thyroid hormone metabolism or gut health. B, dysbiosis can impair absorption of nutrients essential to thyroid function. C, a healthy microbiome eliminates the need for iodine in thyroid health. Or D, H. pylori infection lowers the risk of thyroid autoantibodies. So the correct answer is B. because as we know, selenium is very important. Microbiome iodine, very important. H. pylori usually is the opposite, increases that risk. So the answer is B. Dysbiosis can impair absorption of nutrients essential to thyroid function. So this is just a little snippet of information. If you're interested in learning more about thyroid health or gut microbiome specifically as it relates to autoimmune issues, you can log into the Advanced and Clinical Functional Medicine platform, watch the class on hypothyroidism that we have, and you'll learn how to optimize your patient's thyroid function through that. So I'm going to pass it back to you, Dr. Tall, and talk about more of the microbiome thyroid piece.
Yeah, thanks so much. I appreciate it because this is now, and I really like the picture that you presented that now gives a better understanding, right, about the thyroid on top, the gut on the bottom, and it is a bidirectional, right? So one of the examples that I always explain to patients is that if you, for example, have a thyroid condition, right? Even if you received those, let's say you received the thyroid medication, but your motility, your gut motility is still slower, and you struggle with, let's say, constipation. You're essentially, what you're doing, if you have, if the stool moves too slow through the intestine, right, it creates a stagnant environment, let's just call it that, right, which allows those harmful bacteria to overgrow and then reduces the beneficial bacteria, right, those will decline. And that also means, by the way, that there's accumulation of toxins and waste product, right, that stays longer, interacts with the gut lining longer, increases inflammation, right? But we have to think about those patients, right? That's how the thyroid, if the thyroid hormones are not properly stimulating the gut motility, for example, that's how many hypothyroidism patients start developing dysbiosis.
Right, yeah. And I think about it, you mentioned something, a lot of times when people get on thyroid medication, one thing they will say is, oh, my bowels improve, I'm going to the bathroom more, which just speaks to the receptors there, in the gut, outside of just the general places we mentioned. So thyroid hormone receptors are pretty much everywhere in the body.
Yes, absolutely. And then the gut microbiome is really important for preventing that inflammation and autoimmunity from occurring and attacking our thyroid. Because we have to remember that the surveys are showing us that majority of the patients that struggle with hypothyroidism is due to Hashimoto.
Right.
And so it's not that if we give them the thyroid medication and send them home, on the balance sheet, it looks that the numbers look better, right, on their thyroid hormone labs. But have we really addressed the underlying factor, which is there is inflammation that is ongoing and attacking their thyroid, right? And that's by the way why some of your patients might be struggling with fatigue, chronic fatigue. That ongoing inflammation consumes a lot of resources from the body and also causes a lot of damage, oxidative stress, and all of that, right? So Maria is asking, can you please review which tests are done to be diagnosed? So I mentioned the GI 360 by Doctors Data. That's the name of the lab, Doctors Data. And by the way, patients there are multiple online websites, which like True Health Labs, any lab now, that, and even some other website like I think it's called Any Lab Now, yes, and True Health, that patients can order their labs for themselves. So if you are, for example, a registered nurse or a pharmacist or a nutritionist, patients can go online if you suspect and you see the signs and symptoms of microbiome imbalance or dysbiosis. Patients can go out and order those labs for themselves. The lab kit will be shipped to their home, and we teach you how to do a complete analysis and review and what recommendations you want to educate them about, right? If you're a primary care practitioner, you can order those labs directly through Doctors Data. And Dr. Esha, I think you worked before with other labs, right? There's other labs that...
Yeah, there's like Vibrant, there's I use Vibrant a lot. There's another one that I'm blanking on. Microbiome Labs has like a nice stool assessment. There are a few different ones out there now.
Yes. Yeah, I would say probably the two labs that I've used the most are the GI 360 is a new one that has more comprehensive analysis, and then there's also Genova Diagnostics,
Yep.
which has the GI Effect. It's called GI Effects Comprehensive. The GI Effects is a little bit more pricey, but it contains a lot of great information like pancreatic enzymes, which are important to break down our food, inflammatory immunity, short chain fatty acid, different markers like beta glucuronidase, which also indicates the estrogen metabolism and detox pathways. So there's some really cool labs that you can use, but Doctors Data and Genova Diagnostics are good places to get those lab testing. So yeah, great question, Maria. And as I mentioned, we're here, so we're live. Ask questions if you have them. We're always happy to help. And so let's go into the, now that we kind of covered these different really how the gut is interacting with the thyroid, right? We want to go into a little bit more about the gut microbiome impact on nutrients that are important for thyroid, that are necessary for thyroid hormones, right? So this is really the influence of the gut microbiome and nutritional deficiency or availability on thyroid hormones. So within the thyroid gut axis, there are several mechanisms that illustrate how the intestinal microbiome can influence thyroid function, right? One of them, directly or indirectly, is the modulating the absorption of the essential micronutrients. Remember that the gut also produces some of those nutrients, for example, vitamin K. It also influences the iodothyronine metabolism, including conversion and storage, and also regulates the immune responses. So let's take a look at a really interesting picture from the 2020 publication in the Journal Nutrients that gives us a visual on how does the microbiota impact the thyroid. So you can see on the bottom the microbiota, and you can see, for example, that impaired absorption of iron and iodine can compromise thyroid hormone synthesis, right? Now, this is really important to know because deficiency of iron and iodine can cause impairment of the synthesis of thyroid hormones. Also, selenium and zinc are important for conversion of T4 to T3, as you can see on the top upper and the top right side. So if your patient does not consume or absorb sufficient amount of selenium and zinc, you might give them a medication, a synthetic T4, but if they're not converting it to T3, which requires selenium and zinc, then they could still struggle with symptoms of hypothyroidism, right? Now, in the middle, you can see from the microbiota, you can see that the gut microbiome also has an important role in the regulation of the immune system, which vitamin D is also a very, very important one, right? Now, this particular publication mentioned the positive effect of probiotics, and we actually have a really a good example for you of a probiotic product that could support healthier function or healthier environment for patients with hypothyroidism. So, because by supporting and providing external support to the gut microbiome, we can help to repopulate those beneficial bacteria that help to modulate inflammation, improve absorption of certain nutrients, right? And so we have an example for you at the end of this podcast today in this class. We're going to mention the specific probiotic strains and which product, which supplement you can find them. But essentially what we want to do is we want the beneficial bacteria to support the absorption of micronutrients, the regulation of immune system, and also supporting the gut integrity. So we're not going to get in too much into the gut integrity today because that's a really big topic. But the gut integrity is important because if your patient have what we refer to as leaky gut, they're essentially it's a condition in which what's the different proteins, food proteins or bacterial proteins like lipopolysaccharides, they don't stay in the gut. They can leak or migrate into the bloodstream where they cause more of a systemic effect. So if you have patients with hypothyroidism, Hashimoto or Graves, it's really, really important for you to learn how to assess the gut microbiome as one major factor that impact their thyroid hormones. So now that we covered that, let's take a look at, let's do a little pop quiz to see if you have been, how well you've been absorbing that information from today's class. So the question is for you, which of the following is one way or major way the intestinal microbiome can influence thyroid function? So option A is it's stimulating the excess production of thyroid hormones regardless of nutrition status. Option B is preventing the absorption of all micronutrients, including calcium and magnesium. Option C, supporting micronutrients absorption and immune regulations relevant to thyroid health. Option D, eliminating the need for peripheral conversion of T4 to T3. So which one do you think it is? You can put it in the chat. I'll give you a few seconds. Okay, so the correct answer is C. The gut microbiome supports micronutrients absorption and immune regulation relevant to thyroid health. Now, if you're interested in learning more about how to evaluate and support your patient's gut microbiome and function and integrity, log into the Advanced and Clinical Functional Medicine platform that we provide access to you and watch the class on functional GI. This is where you're going to learn more specifically about the different enzymes and proteins and bacteria and what are the important strategies and tests to evaluate and treat your patient's gut microbiome and really help them to restore healthy function. So this is where we are kind of going into talking a little bit more about gut permeability. I know it's a big topic. We have specific class on gut permeability, like a 3-hour class just on gut permeability and the structure and how different bacteria impact and all of that. It's fascinating. But Dr. Asha, I know that the gut integrity is something that, and the gut microbiome is unfortunately not really taught much in medical schools and nursing programs, right? And this is why it's so important to learn about those topics.
Yeah, it's very important to learn about. And, it's interesting now because intestinal hyperpermeability is becoming like a real thing in medical world. And it's always been like, I feel like a thing in the functional world. And so it's really nice to see more science in the intestinal leaky gut space now. But I think, a lot of the functional medicine thought has always been to focus on gut health in general. So when we think about leaky gut, it's just increased intestinal hyperpermeability. And so the intestines are obviously permeable. You want them to be permeable so you can absorb your nutrition and things of that nature. It's just when they're hyperpermeable is when there's an issue. So intestinal hyperpermeability, commonly referred to as leaky gut, may facilitate the translocation, so the movement of microbial components or bacteria into systemic circulation. So this process can trigger immune activation and promote the production of autoantibodies. These thyroid-directed autoantibodies play a role in the pathogenesis of autoimmune thyroid diseases such as Hashimoto's and Graves. Disruptions in gut epithelial integrity and microbiota composition can impair your immune tolerance. So this can lead to dysregulated immune responses. Given that we always hear like, oh, your immune system is housed in the gut, and that's true. 70% of your actual immune system resides within your gut. It's a specific type of tissue called GALT, G-A-L-T, gut-associated lymphoid tissue. It's actually in your gut. So any disturbance in this local environment has the potential to affect systemic immune function. So alterations in your gut barrier, leaky gut, or microbial imbalance may therefore contribute to the initiation or exacerbation of autoimmunity, including thyroid autoimmunity. Let's look at this really cool picture from a 2024 publication from the journal Nature Reviews Endocrinology. It looks at the thyroid gut connection a little more detailed as it relates to intestinal permeability. So when you look at this picture, you see to the left the human body. You see the thyroid gland at the top. You see the gut at the bottom, and then they do like a zoom in image. So the very bottom center, that kind of horizontal strip is supposed to be like a snapshot in the gut, right? So you'll see the gut epithelium, you see the tight junctions and the layer, you see the lumen, the open section where things are kind of floating around. And so it's showing us two different ways by which the leaky gut intestinal hyperpermeability impacts thyroid health. So the very bottom where you see the red, the blood vessel. So this is looking at intestinal leakiness, and it's showing us that, hey, these kind of products are getting into the system, into the bloodstream. And then to the very right, kind of the right bottom corner, it's saying, hey, there's a potential impact on immune activation, and it's kind of like a trigger or stimulation of autoantibody production. So it's kind of like I tell people that your gut's kind of like this security system. You have all this like security layer in your gut. So when you have this intestinal hyperpermeability, things that are not supposed to be getting outside the gut, they do. And so the body gets into like hyperactive immune mode. So it has potential to impact different systems. So in this picture, they're kind of showing you a mechanism for thyroid specifically. So you generate these autoantibodies, they attack the thyroid, and you kind of have this autoimmune thyroid picture. And then at the very middle section, you go back there, you see that circle in the middle. Is kind of highlighting how intestinal permeability can impact immune regulation, and just that immune imbalance can then go in a different pathway and trigger thyroid issues as well. So there are many ways by which the intestinal microbiome and the intestinal epithelium can impact our thyroid health. So I would definitely say that this is one of the better pictures to kind of keep in your mind when you think about how your gut impacts your thyroid, more nuanced in terms of a leaky gut perspective. And so that's a kind of a more complex picture. Let's take a look at another image. It's a little simpler from the journal Frontiers in Endocrinology. This one's going to be more of an oversimplification of the same process. So we see that when you have dysbiosis that occurs, it can lead to, like we mentioned, increased intestinal permeability, aka leaky gut. So this is allowing microbial antigens to translocate, move across the epithelial barrier, and trigger this kind of security guard system, right? Triggers your immune activation. So as we saw in the previous picture, the immune activation can contribute to the development of autoimmune thyroid diseases, or by directing immune responses against the thyroid tissue. So those autoantibodies that we saw. Additionally, the gut microbiome can influence immune signaling pathways such as toll-like receptor 4, which is a huge receptor in the leaky gut world if you kind of get into that research there, and promote a shift in your T helper cell profile from T helper 1 to T helper 2. So if you are into the autoimmune space, you want to kind of dig into that T helper 1 and T helper 2 balance picture, and you'll kind of see how some of the literature talks about microbiome shifts of this kind of immune response that lends to autoimmunity on its own. So both of those mechanisms, the toll-like receptor 4, leaky gut, implicated in the pathogenesis of the autoimmune thyroid diseases. And then you'll see to the left corner section, the SCFA, those are your short-chain fatty acids like butyrate. And you see kind of the pathways for inhibiting this autoimmune process in the gut, right? So the short-chain fatty acids help with strengthening your cell integrity, helps with modulating the balance of that pro-inflammatory T helper 17 cell cytokine systems, helps with protection of those pathogenic components in the gut, and also helps to inhibit inflammatory processes, because short chain fatty acids like butyrate are actually anti-inflammatory in the gut. Just showing you different ways by which the microbiome and intestinal barrier can impact thyroid. But then on the other hand, things like short chain fatty acids that you can get from eating fiber or get from supplements. I think we talked about a supplement last time on butyrate for short chain fatty acids, which is a short chain fatty acid. So if you're interested in learning more, because I could talk about this all day about the gut endocrine axis, log into your course dashboard. We have courses like Dr. Tall mentioned, long courses on intestinal permeability, thyroid health, and so forth. So log into your dashboard in the advanced and clinical functional medicine certification program to revisit these modules. And of course, you can always book a coaching call with us. So we'll do I think this is our last pop quiz. So pop quiz, how might intestinal hyperpermeability, aka leaky gut, contribute to autoimmune thyroid diseases like Hashimoto's or Graves'? A, enhances absorption of iodine and selenium, reducing thyroid risk. B, blocks the production of thyroid hormones at the gland level. C, it allows microbial components into circulation, triggering immune responses and autoantibody production. And then D, it increases GALT cell production, which suppresses immune activity. So how does intestinal permeability contribute to the autoimmune picture? So the answer here is going to be C, right? Allowing those microbial components into circulation, triggering the immune security guard system, and then autoantibody production. Correct answer is C. So now we'll talk about probiotics and how to actually support a microbiome in the autoimmune thyroid picture. So I'll pass it back over to Dr. Tall.
Thank you, Dr. Esha. This was wonderful. So now we have a better understanding how if we have this microbial imbalance, it can obviously it can by itself cause increased intestinal permeability, but once we get these particles in our system, right, in our systemic circulation, now it can really do some extensive damage by triggering an immune response that will continuously attack our thyroid, right?
Yep.
So that's one way in which I would say probably like an indirect way that the gut can impact the thyroid, right? So we wanted to talk about targeted probiotics and give you an example of how can we use probiotics to support healthier environment for thyroid function. So if you got patients with hypothyroidism, what can you do from tomorrow to already start helping them? And this is more of a functional integrative approach. So, and then we have some really good questions in the chat, which we're going to get to about absorption and some tests and all of that stuff. So that'll be really cool. So when recommending probiotics for thyroid health, really the goal is to choose a product with the strains that support the overall microbiome balance, right? And by supporting the gut health, probiotics can help to improve the intestinal microbiome, strengthening the mucosal immune function, support overall immune health, enhance the intestinal barrier, and boost the production of short-chain fatty acids, which have an immune modulating effect. So they can help reduce inflammation, improve the nutrient absorption of all that stuff. Let's take a look at a really cool image from a study published in 2021 in the journal Nutrients, which shows some of those beneficial bacteria. So you can see we have L. acidophilus, we got S. thermophilus. So for example, L. acidophilus acts as effective strain to regenerate skin, right? Saccharomyces improves immunity, right? We have L-rhamnosus on the right side, bottom right side, which improves intestinal integrity, right? There's also another strain, S. thermophilus, that improves nutritional status, right? So you can see these are really examples on how having the right strain of bacteria in your gut has very specific function that helps our body's natural or healthy physiology, right? It's hard to see. There's also the internal ones, the kind of the pink circles, and bifidobacterium. There's certain species of bifidobacterium that can actually support healthier body weight. When we talk about during the functional weight loss training, certification training, we actually talk about specific strains of probiotic that were found to help help with a loss of between 3 to 8% of body weight just by introducing into the body specific strains of probiotics, right? Think about it, between a loss of 3 to 8% of the body weight just by introducing certain strains of probiotic, right? We're not talking about exercising more and burning calories. That's obviously exercise is important, right? But we're not talking about an intervention of exercise. We're not talking about interventions of cutting calories. We're not talking about dieting. We're talking about literally just introducing specific strains into the gut, and there's improvement in the body composition, which is an amazing example of how important it is to have healthy gut and balanced gut microbiome. So we picked a specific product. It's called Claire Therabiotics, and we'll show you a picture of it. We are, as a general disclaimer, we're not affiliated with any supplement company, so we don't make any profit by recommending any supplement to you. On the contrary, we do our research to recommend only professional grade supplement companies, and there are several professional grade supplement companies, and this is one of them. So this is called Therabiotic Complete. And the reason why we brought this one as an example is because it contains 12 different probiotic species that were found to be beneficial for creating a healthier environment. And you want to make sure that it's a product that has significant amount of CFU, which are the amount of viable, essentially, bacteria in the probiotics, bacteria in each capsule, right? So this is one that you can look at and when you are looking into a probiotic for supporting patients with hypothyroidism. Now, of course, and this is something Dr. Esha that we'll probably might want to add to it, but Dr. Esha, when we look at probiotics, right, it's really important for us to mention that probiotics are really more beneficial when a patient has loss of beneficial bacteria, right, than if a patient have dysbiosis. Because if they have dysbiosis, if the lab finds that they have dysbiosis, we also have to address the dysbiosis, right? Right. So if the patient has, for example, SIBO, a small intestinal bacterial overgrowth, or pathogenic bacteria and imbalanced bacteria, in many cases, we have to learn how to address that properly, right? So probiotics are very beneficial, but you remember, if your patient has overgrowth of harmful bacteria or imbalanced bacteria, you might have to do antibacterial herbs, and we have specific treatment strategies, and some of these studies were found to compare. We even give you like a combination of herbs that compare them to antibiotic treatment, and they've seen a very positive impact on the gut microbiome with less side effects, which you can get from antibiotics, right? So let's answer a few questions. And as usual, I just wanted to mention that, and Jacob will show the picture of the program, but to learn more about the gut endocrine axis, log into the dashboard in the Advanced in Clinical Functional Medicine certification program, revisit those modules. So we have modules on gut health, the gut brain, the gut endocrine, the gut heart. We also talk about other factors that can lead to hypothyroidism or Hashimoto, such as environmental factors, such as cellular dysfunction, such as nutrient depletion, right? And so that's really important. And if you are a guest here in this class today, and you're interested in more information about this very comprehensive training that is clinically focused, and we give you all the tools, all the treatment strategies, and coaching, one-on-one coaching is included, then reach out to us. So Dr. Esha, let's answer a few questions, and really interesting questions. So I'm glad you guys are so engaged. So the first one is, if TSH is high, let's say like 8, the example they gave here is TSH is 8, T3 and T4 are within the normal range. What does it mean? Well, it could mean different things, but typically it could mean subclinical hypothyroidism, right? That means that your pituitary essentially sensing that the thyroid hormones are starting to decline. So it pushes more thyroid stimulating hormone, right? Which is essentially subclinical hypothyroidism. Next question is, what about GI mapping? Do you have some experience with GI mapping?
Yeah, I think GI mapping is a good test. I think that it just depends on what your preference is as a practitioner. Some practitioners want to do more comprehensive stool testing. I don't think there's some markers that GI map does not look at. There are some that GI map does look at. Some people are really familiar with the GI map test and the microbes that it tests for. So I think GI map is a really good test. It's just whatever your preference is. Most of the stool tests these days are pretty standard with how they're assessing the stool and the microbes. So, yeah.
Yes, absolutely. There's a lot of good tests out there. We mentioned a few of them today, but as Dr. Esha mentioned, it's really the preference of the practitioner. Next question is, if we find that or we suspect that absorption of nutrients is not happening properly, can that issue be treated by functional medicine? So yes. So there's two sides to it. One, how are you measuring nutritional depletion, right? In the standard of care, it'll be a blood test. In the functional medicine approach, which we teach, and unfortunately other programs don't talk about, but the gold standard in functional medicine is the cellular nutrient assay, in which we don't measure the level of nutrients in the blood. We measure in the serum. We measure it in the white blood cells. And there's multiple reasons why we do that. We're not going to get into that. That's like a 2-hour class by itself. But essentially, the principles behind it is that white blood cells live longer than plasma components, and they show nutrients availability over time, right? So you have to remember that as we eat and our body utilizes magnesium, B vitamins, for example, it fluctuates in the bloodstream. So when you get in a blood result of nutrients level, you're just getting a snapshot of what's happening right at the moment they drew your blood, right? While white blood cells live longer, so you get a snapshot of what's going on average, right? And another thing that we have to remember is that when we are looking for functional deficiencies, right, we're looking at the serum levels, there could be still functional deficiency if the body's uptake or utilization is impaired. And then also remember that white blood cells are sensitive to oxidative stress, inflammation, right, which make them an ideal target for nutrient function assay, right? So measuring nutritional level of nutrients inside the cells. So that tells us how our body also utilize or uptake those levels of nutrients, right? So that's a whole different lab testing than what would typically happen. So we use lymphocytes essentially, and there are some really good tests that will measure over 30 vitamins, minerals, antioxidants, amino acids, and other metabolites. And we teach you all of that in the certification program. Dr. Esha, the next question is, can we get hypothyroidism without Hashimoto?
Wait, there is a question before. It says, if one does not absorb nutrients, can that be treated by functional medicine?
Oh, yes,
Yeah.
yes.
Yeah, I was just going to say, yeah, I mean, absorption issues can vary. You know, it could be if you have bowel issues, digestive enzyme issues, stomach acid issues. There are many issues that create digestive absorption scenarios. So yeah, I mean, 100% you can see that improve with functional medicine, depending on what's the underlying culprit. For example, if you have pancreatic issues, right? And lots of people are underdiagnosed or misdiagnosed for that one too. And adding like digestive enzymes can be a helpful way to help solubilize, break down the food, so it's easier for the small intestines to absorb them. So yeah, there are many things you can do to optimize absorption of nutrients in the gut. Microbiome therapies, like we just talked about, probiotics, things of that nature. So yeah.
Yes, that's a wonderful question. And the answer is always like, what is it? What's the underlying cause? Right. And that's what you want to, as patients that have been struggling for a long period of time, and even as health optimization, right? Like we would get sometimes patients that come in and they say, I'm feeling tired. I got like, brain fog or decline in memory, or something is wrong in my body, and my primary care provider can't figure it out, right? And that's because when you go to a functional medicine trained practitioner, they can look at the whole picture. They can say, oh, like Dr. Esha mentioned, do you have low stomach acid, which can impair the breakdown of protein, absorption of B12 or calcium? If you got pancreatic insufficiency, then you have reduced digestive enzymes production. You can have bile flow issues that impact absorption of fat-soluble vitamins like A, D, E, and K, right? You can have inflammation in the gut. You can have microbial disruption. You can have, it could even be food sensitivities. We've seen patients with food sensitivities, not allergies, but sensitivities that have impaired nutrient uptake. So the question always is, in functional medicine, is like, what's causing it, right? And then next question, Dr. Esha, is, can we get hypothyroidism without Hashimoto disease?
Yeah, I mean, I would say, not all hypothyroidism is autoimmune in nature. A lot of it is, right? But you can have non-autoimmune hypothyroid issues. Plenty of people have classic hypothyroidism and no thyroid autoantibody response, right? So then you go back to just the general nutrients, like what does the thyroid need to thrive, to live, to survive? You think about kind of the HPA, hypopituitary axis kind of scenario, and how that can impact the thyroid. So yeah, that's a possibility.
Mm-hmm. Yes, absolutely. And then Tanya is asking, if the patient is already on levothyroxine, have normal TSH, T3, and T4, but still do not feel well, would you stop the medication while starting probiotics and doing gut microbiome workout?
I would say no, I wouldn't stop. I mean, I wouldn't stop the levothyroxine. There's no contraindication to thyroid meds and, gut support, right? So I wouldn't say it's something that you need to stop. I mean, but the question would be, what's happening? Why is this person not feeling better when you look at the thyroid parameters that should be improved with medications like levothyroxine? So yeah, I mean, I think it's a good idea to do while they're on their medication, which they likely have been on for a while. Go ahead and do the microbiome workup. Go ahead and start with your microbiome tools that you want to support their thyroid with.
Absolutely. As a general guideline, we would never recommend a patient to stop taking their medications, which are there to manage those conditions, right? What we want to do is really figure out, and we always used to have those patients come in, and even if as they start feeling better, like when their symptoms improve, they're like, oh, can I stop taking my thyroid medication? We would always tell them the same thing, right? As we work on the underlying causes, your symptoms, you're going to start feeling better, which is great, right? But in order to reduce medication, we would always send them back to the prescribing practitioner, either their family physician or a specialist, to monitor them and if possible, start tethering them off the medication very slowly while they're monitored, right? So if you're resolving the underlying problem of why they're feeling the way they're feeling, then the prescribing provider can monitor the reduction of medication and see if they need further support as they do that. We also have to remember that there's a lot of other concepts when we talk about thyroid hormones that we did not talk about today. For example, patients can have normal levels of TSH, T3 and T4, but still have symptoms of hypothyroidism because one, they might have Hashimoto, so their thyroid is being attacked, right? They have an autoimmune condition which could lead them to feel fatigue. They can also have gut dysbiosis that causes systemic inflammation that can impact the brain, cause brain fog or digestion. And then we didn't talk about the other factors like reverse T3, right? Under certain conditions, the body will take T4, convert it into reverse T3. Reverse T3 essentially is an anti-metabolite. It will plug into the receptors of T3 and will prevent the body from utilizing that T3, right? So essentially, your patient might have normal levels of T3, but because the reverse T3 is plugged into the receptor, that T3 does not impact the cells. It does not stimulate the metabolism of the cells. So that's something that we further have to test, look at, and then there's treatment strategies more specifically for reverse T3, which we can utilize. So great questions, everybody. We really appreciate your engagement because that gets more out of this class and you learn more out of it. So as usual, let's keep the learning in the platform. And if you're a guest here and you're interested in more information, reach out to our team of admins, which can help you to tell you how you can get certified, learn more about those tests and mechanisms. And of course, as part of the program, we encourage you to book a call with Dr. Esha and Dr. Chill. Our team is here for you. It doesn't cost you any more to do case studies. Bring your patients to the case study. Use the evaluation tools we give you, the treatment guides, and we are going to help you to understand which labs are more appropriate, more indicated, and what to do with those patients, how to utilize functional medicine. It doesn't cost you anything. It's really all a part of the functional and nutritional medicine program. So thank you all of you for being here. I want to thank Dr. Esha for sharing her years of clinical experience.
Thank you for having me.
And I want to thank our media team and Jacob for making this happen and allowing us to interact with you wherever we are. And I want to thank each one of you for being here, for being there for your community, for your patients, and really bringing hope and new strategies to help those patients who have been struggling for so long with their symptoms, and they're not finding answers in the mainstream approach. So thank you for everything you're doing for your patients and your community and for continuously developing your skills. So have a good evening and take care, and we'll see you in the next class.